Hi everyone, I'm Sarvi Sharma from MedAb Overseas और आज मैं यूनिवर्सिटी जियोमेडी के क्लिनिक जहाँ पर बच्चे अपनी क्लिनिकल रोटेशंस के लिए आते हैं वहाँ आज हम विज़िट के लिए आए हैं। सारी चीज़ें आज सारी फैसिलिटीज़ देखेंगे, अंदर क्या फैसिलिटीज़ हैं हमारे इंडियन स्टूडेंट्स के लिए। लेट्स गो। Please introduce yourself, sir.
Hello, my name is Jarji. I'm from Georgia. I'm professor in the Geomedi University and also head of the Geomedi Rehabilitation Clinic. This clinic is located in the center of the Tbilisi, one of the famous and greatest street, the Avenue. It is very old building. The facility is completed with new approaches of this field of the rehabilitation. Our major role in this clinic is treating mostly musculoskeletal conditions, disorders, traumas, injuries, also post-surgery. But we have patients as well as neurological patients, post-stroke period, maybe low back pain or cervical spine problems. I'm very glad that I have a chance to work in this great facility. I have a chance to be a part of this very exciting family that we call staff, and and to be honest, it is really very friendly environment here, and everyone feels happy. Students always mention that they have I know some to be honest, very practical our this here in this facility. We give students chance to have very clear understanding with some very intriguing topics. Also with have direct communication with the patients, and I think they like it.
Right. So how many students come, like Indian students or mixed batch it is?
So approximately per group is maybe 15 students, maximum 16, from 10 to 15. And the sessions, the clinical rotation takes approximately 10 days, and during these 10 days they cover some of the most intriguing and mostly interesting topics for me and for the patients. We choose topics regarding the patients, so mostly we have this kind of patients, so we want to give them not only theoretical but also some practical skills.
So majorly we focus on practical.
Is also consists of this kind of topics.
Like how Indian students feel great, or like how they are feeling on their clinical rotations.
Approximately 4 years ago, our professor rector, Ms. Marina, decided to students to have the opportunity to deal with these patients, to have their own environment, building. So they decided to make this rehabilitation clinic, and every student in the University Geomedi have an opportunity to come, watch, not only watch but take some they are really helping us. They are like assistants for us, and this is one of the greatest opportunity, because mostly in other clinics we are standing like this and we are just watching or waiting outside. And it is because there's lots of patients, lots of staff, and when you have a lot of patients, of course you have more time to deal with the doctors, physical therapists, and the more patients you see, the more is your practice
so
increased.
The patient flow is good here?
Very high number, mostly 4,000 patients, but we do not record this how many times they visited. This is very great because per patient stays here roughly for 10 to 14 days, so huge
Huge
the amount
number.
is
The
the
patient number is huge.
Yeah,
Great. That is great.
Yeah, and not only once, maybe 3-4 months later, new injury.
Multiple visits.
Yeah, multiple visits, and still in number, when you sum those numbers, it's huge.
Yeah, it's
and
huge.
Very grateful for the university to give this so great opportunity. It's really, really rare in Georgia, and I really thank to the University Geomedi to give us this kind of facility, this opportunity, and my recommendations for the students are come here, see what we do, how do we treat, and how do we teach.
Okay. Thank you so much, Dr. Jarji, for sharing this information with us. Thank you so much.
Thank you.
This is the reception area.
Yeah, this is.
So this is for the exercise for rehabilitation.
Yeah,
Okay.
this is the schedule, which patient, on what time, which day, and so on.
Yeah. This is for physiotherapy.
Yeah, all the procedures, for physical therapy.
Okay.
Massage room.
This is the massage room.
Yeah.
Okay.
There's a balcony there. Nice view on the Tlakano street.
Right.
Here is the Presso therapy.
Physiotherapy.
Presso.
Presso therapy.
Yeah.
Okay.
Here we have another massage room.
Okay.
This is magnetic field therapy as well.
Magnetic.
Magnetic, yes.
Okay.
Because as we see the results with patients, this therapy has one of the greatest impacts on the health, mostly on musculoskeletal conditions, arthritis, so on, with hematoma pain, lower back pain. It helps great. So. When cardiologists come here for consultation, E.C.G.
E.C.G.
Yeah, and stuff. Okay. And the hall for let's call it private sessions, not actually private, but private, because some are shy to work out with other patients, like elderly patients are ashamed. I don't know why, but people are strange and they prefer to be alone to doing like some exercises. Yeah. And we have this space for them, especially for them. This space therapy for children.
Okay.
And we have the ultrasound, diagnostic ultrasound.
Okay.
For MSK, musculoskeletal systems. Joints, muscles, ligaments.
This is the ultrasound machine.
Yeah, ultrasound machine, 22 years, February. It was like fresh one when we bought it, and our radiologist is very excited with this machine. I don't know how to use this, but she says that this is great.
Okay.